everyone. My name is Mark Anthony with Edge on Regenerative Medicine Show. I'm excited today. We have one of the top specialists in stem cell therapy. This is Dr. Zack Parker. How are you doing, Dr. Zack?
I'm great, Mark. How are you doing?
You know what? I'm excited. I have got my warm cup of coffee here. Actually, it's hot tea, and just enjoying life. And I'm excited about life because we get to hear from you on how we can help other people take their life to another level and to get out of pain. And before we kind of get into talking about, important questions that people are asking right now, stem cells, I want to just give a little bit of bio about you, Dr. Parker. And one of the things about Dr. Parker, he has a doctorate in chiropractic in Texas. He has, ES degree in anatomy and also in health and wellness. He's a member of the International Chiropractors Association and of Texas Chiropractic Association. His practices that he's worked with, which is pretty unbelievable. He established and founded the West Texas Wellness Center in 2008 and Yahweh Chiropractic, and co-founder of an education facility director for Clear Mind of Amarillo Regenerative Medicine Center. So there's a lot more I can say about you because the list keeps going, but we'll take it from there. So I'm just going to ask Doctor just 10 questions that I've got a lot of people that have been asking us about stem cell. And before we go into those 10 questions, I'd like to ask you, what got you into stem cell and why?
Well, actually, stem cells have just been the research and just what's been out there about them. It's always been amazing and intriguing to me as far as the research and what's done. Is I began to hear more about what stem cells were and learn about those in my own education but what really has brought me around to using them and defining them as a tool for my patients. My father and I both have been studying stem cells for quite some time. And my father was looking at having to get knee replacement. We were talking about trying to do alternative therapies to try and keep him from having to get stem cell therapy. And
right.
He's an alternative medicine specialist as well. So we've been conversing back and forth, both doing research into different things. And we use some other therapies here, laser therapy and some of these other things that are regenerative in their nature. And we were just looking to try and find a way to help him. And stem cells kept on coming up. It was one of the big topics that kept coming up. We kept visiting about it, kept talking about it. It was interesting. There was a lot of different stances as far as what different people were saying about how effective it was and where the FDA stood on the ability to do it in the United States and everything like that. And so we finally got the opportunity. After doing the research, we determined that the regenerative medicine process, and especially stem cell therapy, was just going to be the best choice for him if we're trying to avoid surgery. And that's really ultimately what we're trying to do, was avoid surgery. He was, he lettered in 5 different sports in college, in high school, and played not professional, but college baseball. Had the opportunity to play professional baseball, just worn his knees out over the years.
Wow.
And so we had to find something, but he didn't want to do surgery, didn't want to have to do a knee replacement from a lot of the risks. And so that's why so many patients end up coming to us anyway. But so we actually did stem cell injections and regenerative therapy for his knees, and they responded fantastic. He's kind of funny. He'll show patients, he'll jump up and down on his knees and say, "See, they're doing so much better."
Wow.
It's been a complete turnaround for him. And he's back exercising every day and staying relaxed, running the stairs and everything. Those are things he's always done for years, which is why they got worn out in the first place. But he's back doing all that now. And so it's exciting and just seeing that. We both were kind of looking into that, but seeing the response he was able to get and actually just having a personal experience with it really excited us. And so we decided to move further into it and began researching the possibility of doing it regularly for our patients, mainly for joint rehabilitation, for joint pain. That's really where our focus with the regenerative medicine and the stem cell therapy is to help to rebuild and restore the function of the joint. not just to get people out of pain. You can medicate enough to get someone out of pain, but that doesn't mean that the functions improve. Doesn't
Right.
mean they're healthier, they're better off. So we ultimately wanted to make sure the person is better quality of life. They can do what they want to do, go out and begin to enjoy life again. That's really what led us to it and got us excited about. And the possibilities with stem cell therapy, the longevity of the correction with stem cell therapy and what it actually is doing at the cellular level of rebuilding the tissue is what got us so excited about just what it could mean for each and every person,
Right.
So that's what led us down that road.
So basically, he tried it on himself and he realized, hey, if it helped me, it can help other people.
Oh, absolutely. Yeah. We saw when it worked, we saw how good it worked for him. I had it done on my shoulder. I got cut playing basketball way back in college and have had trouble with my shoulder issues for years. And so I got my shoulder injected and I don't have any pain or any problems with it anymore. And so it's just, we just seen it be so effective. And, obviously we tested out on our family members first. We kind of did, and we were kind of solidifying our protocols for exactly how we wanted to do it. And just everybody had great results. And that's been the beauty of it so far. So that's kind of how most things that we end up doing in the office, usually we've done something, we definitely experimented on ourselves first, make sure to see the results are what everybody claims they are, and then we're getting the outcomes that we expect. And that's what we've seen, and that led us down the road to continue to provide it for patients and to begin to make a difference in other people's lives and how it can help them.
I like that. It's funny because, not funny, but it's awesome how you're saying how you basically got into this is, hey, if this can help my family, I can help other families. And so that's basically people helping people. So I've got some great questions here there's a lot of people that are on Facebook Live and Twitter and YouTube, and a lot of the questions that they have about stem cell. And one of the questions was, what is regenerative medicine and how is it different than traditional medical care?
Well, that's a great question because so many people don't really understand what it is. At the core, regenerative medicine is actually helping to regain function by rebuilding, restoring, and actually helping the tissue to regrow in the joint or in the area. Now, there are fields of regenerative medicine where they're actually trying to regenerate, grow organs and tissues in that nature. Now, we're talking from a joint level that we're trying to rebuild and restructure and help regain the original structure and integrity of the joint, whether it's a knee or a shoulder or a hip. And so traditional medicine approaches it from you really have an option of surgery, you have an option of medicine. So the medicines are going to try and decrease inflammation or change the way the brain interprets pain. They're not going to actually do anything to help restore or rebuild the joint. With surgery, you're taking a foreign object and basically you're taking the knee out and putting a new one in. There's all kinds of problems and issues with that. And, it's unfortunately, statistically, about half those work great, about half don't. So those aren't great odds in Vegas, or they are in Vegas, but not in your body. Okay. So there's just a lot of complications that come with that. A lot of people don't get full results and full response with that. And there's infections and all of those type issues that were the downtime from the surgery. There's just so many different things that complicate that. And so with regenerative medicine, we're actually trying to use the body's own natural healing mechanisms to regenerate, restore the tissue so you can restore normal function and reduce the pain levels so that you can get back to enjoying a good quality of life again. That's really at the core of what regenerative medicine. There's a lot of different stem cells, one part of that. It's one of the major parts, but there's some other things that use regenerative properties in the body to heal, things like PRP. There's some other things, but when you're talking about a joint, if you're facing surgical type issues, knee replacement, hip replacement, shoulder replacement, then stem cells, you're going to have to talk about the stem cells are kind of the peak of the regenerative therapy process. And they do a fantastic job. We're just seeing some amazing stories come in on how well patients are doing and avoiding the surgeries and being able to get back to doing what they want to do. So
awesome. I like that. Another one is, what exactly are stem cells and how and how do they play a role in regenerative medicine?
Well, the stem cells are at the core of the regeneration of the body. Stem cells are an undifferentiated cell in the body. Without getting too complex with the biology of all this, they're a cell that basically we use, what we're talking about are called mesenchymal stem cells. And mesenchymal stem cells are undifferentiated, which means that they don't have a purpose yet. They haven't been designated. A lot of the other cells in our body, we have muscle tissue, or we have a bone tissue, or we have a nerve tissue, or a tissue for the heart, or tissue for the gut, or for the skin, whatever it is. A stem cell is an undifferentiated cell, so it hasn't got a purpose yet. It hasn't been told this is your job in the body. And so it can literally become, the mesenchymal stem cells can become literally any other kind of stem cell in the body. So they can become other tissue. They can become cartilage in a joint. They can become a ligament cell, or a tendon, or even bone. So they can actually be differentiated into other tissues. Now, there's multiple properties about the stem cells that make them very unique and make them very powerful. At the core, they're anti-inflammatory. And anytime you're talking about pain problems in the body, you're always talking about inflammation issues as well. And so that helps to decrease inflammation in the body, and they are very naturally anti-inflammatory. They also help to slow down apoptosis, which is cell death. So we're always in a process in our bodies of regenerating and degenerating. So our cells are always being broken down, and we're always rebuilding new cells. Now, the problem is when we start breaking down faster than we are remodeling and rebuilding in our body, then we start to age or see a degeneration or a breakdown or a decrease in function. So as long as we're regenerating faster than we're degenerating, we're staying healthy. And so if we can slow down cell death, then that actually allows us to speed up the rate at which we're regenerating, and so we can rebuild the tissues. So that's another thing that they're very good about. Now, one of the most powerful things about them is the fact that they actually also differentiate very quickly. They can become another stem cell, or divide and create another stem cell very quickly. And that's where the value for regeneration is because these stem cells multiply very quickly. So obviously more quickly as we're younger, they're much more metabolically active. So a stem cell will basically replicate about every 28 hours in a newborn or a child. And so by the time we get to be about 50, that's slowed down, and it replicates about every 58 hours. But they're still replicating. And the replication produces more cells, and those stem cells can now become other tissues. So they can become stem cells, or cartilage cells, or ligament or tendon or bone, or whatever they need it to be. So the stem cell, the fact that it can produce more cells and newer cells of whatever it is we need. If we've lost cartilage in the knee and we're trying to produce more cartilage, those stem cells can actually, once they're introduced into that area, the body's innate intelligence begins to communicate and tell the body what it needs to repair and regenerate that region. That helps the cells then to differentiate into whatever kind of tissue they need to become. So,
wow. So
where they become so powerful.
So what if, I'm just going to use this as an example. Let's say I have a knee pain and I'm getting bone on bone. And would it only regenerate that one area of the body where where they put a stem cell inside me? You know, let's say if I have a knee pain and then maybe right below it, maybe my ankle, or will it regenerate that entire leg part? How does that work?
Yeah, well, the majority of the stem cells are going to be in the area that we inject, but they're going to migrate some in the body. And so they're also attracted to inflammation and those type of processes in the body. So if you have an inflammatory process going on, you have another injury in the body, some of those stem cells are going to be migrated to that area too, because the body naturally disperses the stem cells into where the body is needed.
So it acts like a magnet, what you're saying.
They kind of act like a magnet. That's it. They're attracted to inflammation, and they're attracted to those things. So that's one thing we do with our patients. We make sure they haven't had a steroid injection, within about 6 weeks of having the stem cell injections. Well, we don't want them to be taking NSAIDs or non-steroidal anti-inflammatory medications for a few days prior, because we don't want to hide the inflammation. We want to make sure that if the body's got an area that's damaged and inflamed, the cells are attracted to that. So we do some other mechanisms, therapy in the office as well, to help make sure that to attract those stem cells to that region. But But there will be some systemic effect, even if we inject it in the knee.
Right.
Will affect some other areas of the body, but the majority of it's going to stay in that region where we inject it.
Okay, that's good. Good to know. It wasn't on the question. I was wondering about that.
Yeah, absolutely.
But the other one that's a real popular one is, what are the benefits of regenerative medicine and stem cell therapy compared to traditional forms of therapy?
Well, the biggest thing is that there's the biggest benefits are going to be a number, but let's start with some of the dangers of traditional medicine. So traditional medicine, like I said, we talked about surgery, we talked about medications, and those are all degenerative models, so they're not going to rebuild the joint.
Right.
Now, trying to rebuild it mechanically with a knee replacement. But you talk about some of your downsides with that is, you have, if you just take the NSAIDs that I was just talking about, non-steroidal anti-inflammatory medications, those are probably the most commonly thing taken. Ibuprofen, Advil, aspirin.
Right.
They seem really safe, but there's over 110,000 hospital administrations every year because of those medications. There's over 10,000 deaths every single year from GI bleeding from taking those medications. And so those are just some of the downsides and some of the complications. And those are over-the-counter medicines, most of those that I named.
Right.
And you think what some of the prescription medications, how much more dangerous those might be. But then you have your surgery and you have your concerns. You have your downtime from the surgery. You have your rehab from the surgery. You have the potential for blood clots, which can be life-threatening. You have your severe infections like MRSA and these infections that are happening post-surgery. And they can happen. I've had patients come in and it's been 6 months or 9 months after the surgery, and they had developed an infection from the site and had to go through months and months of, major antibiotic type therapies, and they've had to take it out. I had one person that had literally had to take it out, the joint, the 3 different surgeries trying to take the joint out, put a new one in, take it out, because it was just so damaged. And these aren't small, minor surgeries. These are major surgeries where you're cutting bone out and you're replacing it completely with it. I mean, it's just if you've ever watched them, they're fairly brutal surgeries to begin with, and you have to do it multiple times. It's just really scary. And so the benefits is you don't have any of that with stem cell injections. They're very, very simple. We'll talk a little bit about the processes and how we use them, but it's as simple as coming and getting an injection, and then the body begins to do the work. The cells multiply, they begin to become different types of
Right.
tissues to rebuild that area. And so the benefits are there's no downtime to it. That's a wonderful thing. You don't have the risk of the infections that you have with the others. You don't have the potential risk of all the side effects of the medications and all those things. But you're able to rebuild the tissue. You're able to rebuild it naturally. You're able to literally come in. You have the injection. So you can do that in a 15-minute time period, and you can walk right back out. Or
Wow.
depending whether you get it in your knee or shoulder, it depends. I mean, you can go back and do your normal function. We just ask that you rest the area for a few days and take it easy for a couple of weeks. Don't do anything crazy. If you get your knee injected, we don't want you to go run a marathon the next
Right.
week like that. But otherwise, the benefits of that side are just you're not facing any of the risks of all the other alternative forms of doing it. And so as you rebuild the joint, you begin, not only do you decrease pain, you begin to regain function, and regaining the function is
Okay. Wow. So does it?
allows you to do the activities you want.
So what if I were to get, let's say something in my shoulder? What's the turnaround time? Would I start feeling something right away? Would it take a week or 2 or 3, or what's the average that you've been seeing?
Yeah, well, that's an interesting question because it's really depending what types of things you're talking about. Sometimes for pain side of it, because of some of the things that we do that are as part of the regenerative medicine process, we do those things a little bit different in our office. We'll talk about those a little bit more as we go through here. It's more than just the stem cell injection. There are some offices that just do the stem cell injection, and then they say you do great. We'll see you in 90 days, or we'll see you in 180 days, and we'll see how that stem cell injection is doing. and that's great. But for most people, there's also some sort of change in the structure, whether it be the alignment of the muscle or the bone structure
Right.
itself, or the uniformity of the muscle function and the balance of the muscles in the joint. And so we have follow-up therapies that we actually address those things. They just make sure that the stem cells do that much better. And they give the stem cells' job is to help to rebuild the tissue, but we want to make sure that that joint is as stable and as healthy as possible so that we don't turn around and damage it again.
Okay.
So those are some of the things that we change. So some of that improves just as we begin to do some of the therapy and get the structurally right. But the stem cells themselves, typically what I hear from most patients is about 4 to 6 weeks is kind of the sweet spot where things really start to get better and improve. I've had patients that tell me, I felt better as soon as I got the injection, doc, which is interesting because we can't put any kind of deadener or lidocaine or something like that in the stem cells because it affects the way the stem cells work. Wow. So it's not just the injection. We're not just killing the pain with some kind of medication. We don't do that in those injections. It's not like that. Like you get typically in steroids or something of that nature, right, where you get that benefit of a painkiller type, because that's not what is in these injections at all. So, but I have patients that tell me, pain stopped within just a couple, with that first day after
wow.
But the typical is we see the improvement about 4 to 6 weeks is when we typically see people really starting to see a change and starting to see the improvement. And the beautiful thing is just the opposite of what you see with degenerative medicine. If you're getting steroids or something like that, you feel a good effect and then it starts to slowly wean off because it's just as the body gets rid of whatever that is you injected, it breaks it down and gets out of it. It's not doing anything to necessarily affect the joint or improve the joint. Where with stem cell is every day that goes by. That's why I love seeing my stem cell patients. Every time they come back in, they're a little better than they were last time because the stem cells continue to get better and better over time. And so it's kind of it's kind of a unique process. But as they have time to continue to help the body get the joint to get healthier and healthier, they get better and better.
So basically, what you're saying is that everyone's different.
Absolutely.
In the way that it's just we're not the same. So it just depends. Just like you said, that one gentleman right away you felt it.
Right.
Okay.
Well,
now
everybody's at a different level of degeneration too. So
exactly.
Yeah.
You don't know if one's bone on bone, one's just the beginning of that. How deep the process is. So
yeah, everyone's gonna be different when they're like that.
Okay. Well, the big question I hear a lot is basically, where do stem cells come from?
Yeah, that's one of the most popular questions I get, and I get asked that a lot. So there's actually several different types of stem cell injections that are available. And so let's talk about where stem cells come from. There's a lot of different things. So let's talk about, because there's different times you want to use different stem cells for different processes or different therapies. Okay, so but one place to get stem cells is what we call embryological or fetal tissue. And that actually comes from an embryo or a fetus. Good news is in the United States, that's completely illegal. President George Bush outlawed that during his presidency. And so you don't have to worry about it coming from a fetus or from an embryo or from a aborted tissue or anything like that. So the ethical questions that come with that, that's not even really a concern in the United States anymore. Now, if you go out of the United States, I can't promise that they don't do some of that outside the United States. But in the United States, that's not where we get any of the stem cells here in the United States. Now, the next place to get stem cells are from the amniotic fluid or from the placenta of the mother. Okay. And there is a fair amount of stem cells in that tissue. The problem with that is there's also a lot of debris in that tissue. It's a little bit harder to get specific types of cells from that tissue. And the other issue with that is you also have a little bit of, you have a chance for picking up some mom cells will have certain antibody factors already on them. So they're going to be less compatible. So if I should have some of that, I may have a greater chance for rejection of those types of stem cells from placental or from
Right.
from the amniotic fluid. So that's a second kind of and place where we get stem cells. Now, a third place we get stem cells is actually what we call autologous, and that is getting stem cells from our own bodies. And we harvest stem cells. You can harvest stem cells from your own body. You still produce and still have stem cells. One way to do that is a bone marrow biopsy or bone marrow aspiration. Okay,
Right.
because we have plentiful in stem cells in the bone marrow. The downside to that is not a very fun procedure. It's rather painful to get a bone marrow biopsy or bone marrow aspiration, and so that's one way to do it if you're doing your own stem cells. The other way to do that is to actually harvest it from fat. It's a procedure almost like a liposuction, and they'll actually remove the fat and then they'll spin it down and separate stem cells from the remainder of the fat. And then those stem cells who knew that our stem cells, that our fat has a lot of stem cells, but there's actually quite a few stem cells in the fat. You can take that once you procedurally separate that, you can take those stem cells and re-inject them back into the body. Now, the good news about that procedure is your chance for any kind of rejection is about nil, because you're using those stem cells to be replaced back in the body, so you don't have to worry about rejection. Now, there is a flip side to that, but you have to do a harvest procedure for both the bone marrow biopsy and for the fat when we do the harvest the fat. So we're having to do two procedures, so that usually raises the cost because you're having to not only harvest the cells but then re-inject the cells, and so it becomes a little bit more expensive. You do have a little bit of downtime of healing up from the procedures themselves of the bone marrow biopsy or from the fat harvesting. But the other part that's really critical, and this is where a lot of people miss it, those stem cells are the same age that whoever we remove them from, they're the same age as you. So if you're 65 and we harvest your stem cells are going to be 65 years old. They're going to be metabolically less active. So remember earlier I was telling you in a newborn, their cells replicate about every 28 hours, whereas someone that's 50 years old does replicate about every 58. So the stem cells are older, so they're slower as far as how fast they replicate. So they're metabolically less active, so they're not as powerful as the stem cells that you may get from harvested from a umbilical cord or something like that. So, that's the third way. And so I'm sorry I jumped ahead there just a little bit. The fourth way we get stem cells is actually from umbilical cord tissue, and that's the last one that most people we're most familiar with now. There you can actually harvest stem cells and from umbilical cord tissue that's donated. It's donated before the birth. The mother signs a waiver that she's donating the tissue, just like you would donate an organ if you were an organ donor or something of that nature. So they donate the umbilical cord. We used to throw that away and used to not ever think anything about it. Who knew it was so powerful? But inside the umbilical cord is it's called Wharton's jelly, but it contains high level of stem cells and very active stem cells and other factors that help for the skeletal development of rebuilding of tissue and things of that nature. And so that's what's harvested and used, and that's taken from mothers and healthy born babies that have been delivered by C-section, and so they harvest those stem cells, and then they're cryogenically frozen. They're tested for any kind of disease or issues like that. They're tested very closely, and then once they passed all that, then they're cryogenically frozen, and then we use those are the stem cells that people use a lot. And now the benefit of that is you can gauge it. You can use as many stem cells or as little as you need. So you can, if I'm doing multiple joints, I can, get the right amount of stem cells that I need. But I also have the most active form of stem cells in the fact that they are the youngest stem cells. So they're the most metabolically active and most potent and powerful. And the last factor that makes them so special is they are antigenically they're undifferentiated at that point, which means that they're neither the mother or the baby's stem cells yet. So they're undifferentiated, but they also they don't have any kind of antibody response yet, so they're not marked that way. So there's no risk of rejection. They haven't had any kind of rejection of these stem cells. There's been thousands and thousands of them given, haven't had any kind of problem with the body rejecting that. So it's been
Wow.
so
There's a lot going on there.
they're kind of the best of all worlds, let's put it that way, and especially for injections. When we're talking about using stem cell injections for regenerative medicine for knees and shoulders and joint problems, it's ideal.
Okay. Wow. So which stem cell therapy do you think is best in your opinion?
That's it. I think the HUCT, or human umbilical cord tissue, I believe is probably the prime for doing joint therapy and joint injection. I think it has the most promise and the most powerful approach to it because of the age of the cells and the replication and the fact that there's no risk for rejection.
Okay. Okay. So you would say that I know that you were saying that normally if you're 42 years old or you're 63, you want to get it from someone that's of the same age, but don't you think that it would be better to get it from a baby because it's younger and more vibrant? And would that be better for an older person? So I'm 42. Do I have to stick with a 42-year-old, stem cell?
No, that's it. You can use the newborn stem cells. They're going to be much more powerful. And so the umbilical cord tissue would be much more powerful for you to do it that way. Yeah.
Well, I never knew that. Learn something new every day. Another great question here is this a one-time procedure, or do we have to keep coming back every month, every year?
Yeah. So if you think about it, it's not like cortisone injections or some of these other things that you do, where you do the injection, it helps reduce inflammation, and then the medicine breaks down, and then the underlying problem's still there. If you think about it, what we're really doing with stem cells, we're actually injecting the stem cells to start rebuilding the tissue in the knee or the shoulder or whatever joint you're working on. So as the tissue begins to rebuild, as the joint begins to repair and regenerate, and you actually begin to restore the healthy function of that tissue, then the kind of joke around with my patients that when you think about that tissue that's newly developed and that has been replaced and regenerated, it's much younger than you are. Okay, it's new tissue versus what your body's been, and so that tissue is not going to go away. It's not going to disappear like your body's not going to break it down and get rid of it like it would the steroid, the medication. And so that new tissue is there. And if we've addressed some of those things like alignment and muscle balance and those things to protect the joint, then now that new tissue should stay and should be functional and be healthy. There's really no reason to think that it's going to degenerate. I would think it's going to last longer than the rest of our body because it's newer tissue, if that makes sense. So
yes.
So the idea of the beauty of it and what we're hoping to see as we go forward, progressing with stem cells, is the fact that we don't have to come back in, and we don't have to repeat this procedure, multiple times, or every year or so. That's not how it's designed. It's designed to be a more permanent fix.
It's because it regenerates like what did you say, between every 24 hours and 64 hours? Is that how that works?
Yeah, depending on the age of the person, about every 28 hours those cells will regenerate. Now that'll happen. That'll happen for a while in that first year that the person is after they're injected. There'll be a point where most of those cells have become other tissues. If that makes sense. So a lot of these stem cells, they do differentiate, so they make more stem cells, and so they're producing more stem cells. Some of those stem cells are then becoming cartilage cells, or then becoming bone cells, or becoming ligament cells or tendon. So they differentiate. So it's not like a never-ending continuation, but it doesn't have to be. We just need it to happen long enough for the joint to rebuild itself.
Okay. Now the biggest question I get is, does Medicare or does your insurance company, does it cover this?
Yeah. That's interesting, and I get that all the time. It's one of the most common things I get asked. And unfortunately, with this procedure being so new and being there's so many I don't know. I just, with the newness of it and the questions of the different variations of how you use the stem cells, at this point, we're not seeing it covered by insurances and not seeing it covered by Medicare at this point. It's not the usual and customary treatment, and that's usually what insurances and Medicare are looking at. Is they're saying, what is the normal and customary treatment for joint problems? Well, normally it's either steroid injections or
Right.
medications or a knee or a joint replacement. And so right now it is not a normal customary procedure, and so therefore it's not covered by the insurances and by Medicare. So we're hoping maybe to see that change in the future, but at this point we're not seeing much change with that at this point.
Wow, awesome. Well, hey, thank you so much for being on the show, and I just want to tell everybody out there in the internet land, please like this video, share it, and not only that, but think about it, everyone. When you're sharing this information, this is vital information. There's so many loved ones out there that we have in our family that need this type of procedure to help them to live a comfortable life. So, anyways, everybody, I want to say thank you for showing up on the show. And I'm sure that we'll probably have Dr. Parker on the show again, because this is a subject that people need to know more about. And thank you so much, Dr. Parker, for being on the show.
Absolutely. I appreciate it, Mark. And thank you for inviting me. Look forward to seeing you with you again.
Well, and your website, what is your website so people can at least take a look at what you're doing?
It's www.amarilloregenerativemedicine.com. And it's just all one word, amarilloregenerativemedicine.com.
And we'll have it on the screen for everyone too. And everyone, again, thank you so much for being on the show, and we'll see you next week. Have a great day.